Hello parents, this is Dana. After you diagnose your child, if he is on the autism spectrum, besides dealing with all the difficult emotions, it's more important to actually gather information and start doing research on the different forms of interventions and decide what's suitable for your child. So you can do early intervention, which is very important for the child's learning. Right now, there are many different types of intervention for autism. I have shortlisted 10 of them, which are more commonly adopted and practiced by parents and have shown good results. And the first one is ABA, Applied Behavior Analysis. This is a form of behavior training which modifies the kid's behavior. And it is one of the most proven methods. However, you have to do intensive hours to yield good results. 2. Occupational therapy and/or PT, physiotherapy, and they deal with sensory, gross, and fine motor skill. 3. ST, speech therapy, and they bring up verbalization skill along with play skills for the child. 4. Listening therapy, and this will stabilize and modulate sensory processing and emotional processing of the child as well. 5. Floor play, and this is in a very casual setting which will enhance play skill and social interaction of the child. 6. RDI, Relationship Development Intervention, and this is a family-based behavioral treatment conducted mainly by parents. 7. Social skill class, and these classes will develop teamwork and coordination among peers and develop skills and play skills along with school routine. 8. Biomedical, also known as alternative medicine. This is a rather tedious and very expensive intervention with many follow-up. 9. Dietary, and this includes going on special diets like gluten-free, casein-free, yeast-free, and they would give good results over a period of time, and it will show especially on kids with gut issues. And lastly, 10. Medication. This has to be monitored and prescribed by psychiatrists. It is always difficult for parents to decide if they should medicate their child. It's like attention span versus side effects of the medication. And there are some schools that might impose mandatory advice on medication for children that cannot focus in classes. Now, a recap of all these 10 interventions that it's worth investigating, and they are ABA, OT, PT, ST, listening therapy, floor play, RDI, social class, alternative medicine, special dietary, and lastly, they are medication. So look at your child's assessment and report and decide which areas is needed more help and is the weakest, and decide on the time and budget spent on each intervention wisely. A positive mindset will lead to a positive future. This is Dana from danalim.com.